different.
Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hairloss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
Well, welcome to the show, everybody. Joseph W. Tillman, thank you so much for joining me.
Well, thank you very much for having me. It's good to be here.
Long time no speak, my man.
Yeah, it's been like, 10 minutes?
Guys, welcome to the broadcast. This is the Hair Loss Show. It is a call-in show. Everyone who's been asking me advice and for help on Instagram, I tell you to call the program. We are live every Friday to answer your questions in detail. There's only so much I can type with my thumbs. First of all, this is relatively new for me, if you think about it. I wasn't born in a world where we had to type with our thumbs. Didn't exist. Put it this way. When I got my first beeper, that was like black magic.
Sorry, you're assuming they know what a beeper is.
Yeah, that's true. So I love putting out the content for everyone. I love providing the information, the truth about everything that goes on in this effed up industry. Guys calling, you just hung up, so feel free to call in 888-659-3727. And I love, exposing the truth, providing people with the harsh realities of surgical hair restoration and the limitations. Sometimes that makes people angry. They obviously have a confirmation bias because they may have gone in a direction that I am trying to inform people who may not have made the decision to jump into surgery. I'm trying to inform them of the reality and the entire scope and the possible pitfalls of this incredibly nuanced and difficult form of surgery. And then the people who have already jumped in head first, no pun intended, are upset. They're calling me a liar, saying I don't know what I'm talking about. They go through the I'm not a doctor, cut at the jugular. All the typical happy horse shit. And then maybe a doctor comes on and says, you know what? Kobren's right. You probably shouldn't have had that 6,000 graft procedure at the age of 23. Because there's a good chance 75% of that donor hair that was moved is going to miniaturize relatively quickly unless every star is aligned for you. Unless somehow genetically you started the balding process early, but it really slowed down in your family, or you are doing well on oral medication as opposed to kind of just trying to use topical because you're afraid to use oral, which I understand. The vast majority of young guys who go for a really mega session, in quotes, it's not even a mega session anymore, 100% FUE hair transplant at a young age will most likely end up with probably half that hair that was transplanted left on their head within a decade, probably sooner. And if medication doesn't work for them, the rest of their native hair is going to start to miniaturize. And then in time, even the stuff that was removed from the sweet spot, unless medication works, will begin to miniaturize. I mean, that could take 20 years, but it could happen.
Mm-hmm.
So, yeah, you may get a good couple of years out of it. Maybe it'll get you through your 20s. I don't know. I hope that it does. But why shouldn't young men who are about to travel across the world, put their lives in some stranger's hands that they've never met, put their emotional and, physical health in possible jeopardy, why shouldn't they have the information they need to make better informed decisions? Why try to stop that information? Or try to somehow, just because you went under the knife, probably prematurely, why not just enjoy your fucking hair transplant? Why are you spending time online watching all these videos about hair transplant surgery? If you are that exceptionally thrilled with your life at this point and the outcome of your surgery, why not just move on? Why do you feel the need to interject your point of view in a manner in which could actually harm people? That's my question, Joseph.
Well, I think that's a good question. And one of the things that popped in my head when you were going through this lovely monologue, misery loves company.
That's true.
A lot of people have been through hair restoration surgery that, and a lot is relative, but that have had unsavory outcomes, we'll say. I don't know, it's a strange one where they tend to be angry at the truth. I've noticed that with some people.
They are angry
with some patients. They're angry about the truth, and they're angry about those that are pushing the truth because it's almost like they're looking for. It's almost like there's a confirmation bias, along with misery loves, like all these cliches that kind of coalesce to perpetuate this cycle. I guess I don't know. It's kind of. Is difficult to explain. It's difficult to nail down to put your thumb on it.
There's this one guy.
But it is unusual.
There's this one guy. He's not super young, but he's probably like late 30s. He looks a little juiced up. And I say that in the kindest way. There's nothing wrong with it, I guess. If you are doing it under a doctor's supervision, you know what the long-term adverse side effects can be of starting testosterone replacement therapy or getting on some sort of athletic performance enhancement drugs at an early age. But he's really almost militant about the fact that, I shouldn't be providing this information to people, that it's somehow some sort of a misinformation, that I'm somehow misinformed. And I'm not the type of guy who normally goes out there and say, hey, look, I have said it, but I know a little something about this shit. I've been in the field for 26 years. I wrote the most read volume in the world on the subject. I write chapters for textbooks now. I write for, different legitimate online resources. I know all the bodies are buried. I see all the mistakes that doctors have made.
Sorry, I'll be right back.
Okay.
I got it.
Doctors have made for the last 30 years. I've seen the casualties, those who believed that they were even happy with the procedure for the first 5, even longer, maybe 10 years of their hair transplant journey, only to realize that this may not be permanent, only to realize that, maybe I started too soon, or maybe instead of listening to my doctor saying, well, if you really don't want to use finasteride, we could still do a little, and we can kind of gauge your progress and see how you do. That usually doesn't work. Why shouldn't the general public, the new young guys who are getting into this, now that this incredibly difficult procedure is being, promoted and commoditized in a way that I've never seen before, to an extent that has grown exponentially online, where people are not just going overseas to get a hair transplant, but who are believe they can just stop by their local facial plastic surgery, their wife's facial plastic guy's office, who just got a neograft and put in the back room, and have a hair transplant. No problem. My hairline's receding. I could fix it. I have the money. I'm going to get a hair transplant. Without being informed about the reality of what happens with this surgery. Can you get a great hair transplant? 100%. I wouldn't be doing this for so long if that weren't the case. I wouldn't be working with the doctors that I've worked with over the years. But God almighty, people, why be upset about someone just out there telling the truth? I have zero skin in the game to tell the truth. That's my reality. My life would be a lot easier if I just stuck with my organizations, maybe even grew the International Alliance of Hair Restoration Surgeons to allow anybody in, and turned it into a educational society. Just continue to do my thing, maybe throw on my camera once in a while, do the show with Joe, and just live the rest of my life. No one would know shit. The money would come rolling in, no problem. It's really not in my best interest to even tell you guys the truth when I think about it. I remember my father, let him rest in peace, when he would hear me on the radio, and he would actually critique me. He would call me up and say, you're going to make a lot of enemies. How do you expect to make a living? All these things. I'm like, Dad, you don't get it. This is what I do. This is how I started. This is what the book was about. That's my whole gig. So when people who are uninformed or relatively new to the game, who are finding my content on Instagram, and they're pissed off because they believe they went to Turkey or wherever and had a great hair transplant, and it really is, just do your research and you'll be fine. No, you won't. You will not be fine in general. It is unlikely that you will be fine having, 4,000 or 5,000 grafts thrown into the frontal hairline and mid-anterior scalp at a young age, and all you're doing is taking topicals and having PRP. It is unlikely that you will be fine. The odds are really against you that you will be fine. And I hate to say that. I don't want to burst anybody's bubble. But for those who haven't made that move, that premature move yet, you need to know. The phone number is 888-659-3727. Guys, the lines were lit. Now they're not. So I'm going to give you a chance to call in. This is a call-in show. I'm not just here to rant and to look pretty. What?
Although he can't help it.
On either,
what's interesting, what you're talking about with people just say, do your research. When I was prepping for today's show, I was putting some links in different social media channels, and I saw some comments on some other subjects being thrown out there about just do your research. And I remember thinking to myself, as I was jumping to another social, it's like, how? How are people going to do research? It was the full statement was something like, do your research and you'll be okay.
Yeah. It's ridiculous.
What does that mean?
There's somebody
if the average person is supposed to be doing research based on what's out there now, aside from a few sources like myself, yourself, Spencer Stevenson, a few other resources, Hair Loss Cure 2020.
I love that guy,
different resources out there. Yeah, he's fantastic. Then I won't say most likely, but there's a strong possibility that they will be follicularly doomed.
In a short period of time.
And they won't even know it.
For years.
They won't even know it until at least a year when their final result comes in, or maybe later when they do have this degradation of the result like you're talking about earlier because of medication's not working. They didn't experiment with that before surgery long enough to know. Too much hair taken from outside of the safer donor area. It's most patients are doomed right now just because they don't have the resources. There's not enough people leading them to legitimate resources where the standards of what people need to know are at an acceptable level.
You know that guy who promotes himself as a human Ken doll? He has like implants all over his body. He's done a lot of plastic surgery shows, and he's kind of developed this career by having like bicep implants and delt implants and chest implants and getting a tremendous amount of plastic surgery. And he's also had hair implants here in Beverly Hills, hair transplants here in Beverly Hills. And first of all, I thought he liked me. I think he still does. But I mean, he follows me, and he makes a lot of commentary now when I post this type of content, essentially saying, I posted a piece of content showing a relatively well-known UK influencer who had a female who had a hair transplant. She had 5,000 grafts moved via FUE. And I was just explaining that for most women, this is a huge mistake, and explained why. And it's his position that, I'm somehow just a hater, and that, people shouldn't be judged for choosing to have cosmetic surgery to make themselves happy. I'm not judging anybody. I'm trying to explain that this will most likely be a long-term mistake for this woman. And I want to help people avoid making the same mistake. There's no judgment involved. My hope is that she's okay in the next 5 years or 10 years.
Yeah.
And then I showed another video of a woman, I don't know what country she's from, who had a very, just uniquely placed hairline lowering procedure, massive amounts of grafts moved. This woman had a very normal hairline to begin with, and just explaining that this will probably end up being a disaster. Well, he got upset about that too. So, Justin, I think if you listen to this program, I want you to know that while, of course, there's downsides to some of the stuff that you've done to your body, when it comes to hair transplant surgery, you're moving live organs from one part of the scalp to the other. A, there's no guarantee that these organs are going to grow properly. B, there's so many nuances to the surgery that you really have to know about. I know that you've had hair transplant surgery, but you really didn't look like you had aggressive or any form, actually, of androgenetic alopecia or male pattern hair loss. So you had a very small amount of work done to your frontal hairline to kind of shore that up and lower it. You went to a good doctor who gave you, provided you with a good procedure. It's a totally different animal than what we're talking about. Now, I'm glad that he takes the time to participate and provide engagement. He's a well-known guy. But I think that's just an example of I hate to use misinformation, but how the uninformed who are influencers could really push people in the wrong direction and eventually cause harm unwittingly. Anyway, let's take a phone call, 888-659-3727. We are live. I'm in Los Angeles. This guy, Joseph W. Tillman, is in Vancouver, and somehow we're doing this show magically.
British Columbia.
Yeah, it's British Columbia. Let's take a phone call. Oh, who do I take first? Okay. Hey, you're on the air. Who's this, and where are you calling from?
Hey, this is Alex from San Diego.
Alex from San Diego.
What
How
up?
are you, man? What's going on?
Hey, doing pretty well.
Good.
Yeah, first off, I got to say I'm really impressed by the way you handle these people in the comments, Spencer. It's really funny to me that people will see your content and immediately get really butthurt and defensive instead of reading between the lines and actually understanding what you're saying. So,
Well, I appreciate
bravo
that,
to
man.
you.
I appreciate
I like
that.
this guy. Anyone that says the term butt hurt is okay in my book. I dig that.
But I also
support
appreciate that you recognize, you know, I mean, you understand. I mean, to me, it's very straightforward. What is the point? What would the point of me just explaining how hair transplants actually work? What's in it for me? You can't really make money from that. I'm not selling anything. You know, so what would possibly be my agenda? I don't hate hair transplant surgery. You know, and it's like these people, you know what's funny about the online world now is no one really takes the time to do the research. They just see some guy talking about this. They don't look me up. They don't try to figure out why is he saying what he's saying. They just knee-jerk react to whatever's online because they only have like 15 seconds to pay enough attention.
Yeah, it's so bizarre, and it stands to reason in my book that if you had a good hair transplant result, like for instance, if I did that and I saw your content, I would be like totally on your side, and I'd show up in your comments and say, hey, this is extremely valuable information. I wish I had this beforehand, or I'm glad I did before actually doing my procedure, or whatever it was. So, yeah,
well, I appreciate that, brother. So what can we do for you?
Well, I wanted to discuss my case because I'm considering surgery. I'm 34 years old, and my hair loss pattern is sort of like Jude Law, I could say. So,
okay.
Not really like the island. He sort of has that frontal forelock island happening, but mine's a little bit more of a peninsula.
Okay.
But very similar. So I guess maybe you would say Norwood 4 or something like that.
That sounds more like a deep 3.
Like a deep 3, yeah.
Yeah, maybe a deep 3. But my crown's pretty good. A little bit of thinning in the crown, but been on finasteride for 5 years. No problems. And I just started oral minoxidil the other day, so we'll see how that goes. Got to give it some time, but I'm giving that a shot too.
Yep.
But yeah, so I'm still considering surgery. So I've spoken with most of the doctors here in Southern California in your organization, and they all seem very talented. And I noticed that most of them seem to be leaning towards FUE, it seems. And I get why. You know, I've watched your content. I understand why that has gained so much momentum, for better or for worse. But they all seem like they, of course, know what they're doing with an FUE procedure. But I'm wondering if, in my case, I can start this journey entirely via FUE and possibly feel comfortable with multiple procedures down the road without doing strip.
That's a great question. I'm going to let Joe tackle it first, and then I will chime in.
No, I'm just kidding. No, with anything, there are variables that will go into the overall game plan. But what you have to ask yourself, or what an experienced consultant or doctor would have to ask you is, number one, what's your family history of hair loss on both your mother's side and your father's side? Are there any male members of your family that have aggressive hair loss, say like a Norwood 5 to a Norwood 7? And if so, who are they? Like how many male members of your family have that type of loss? One question I started asking many years ago, based on my own personal experience and having recognized a correlation, is which side of the family do you physically resemble the most? And which side of the family has more hair loss, if any? And if you resemble one side versus the other strongly, and that side has more hair loss, I've noticed a correlation where you're more likely to have that type of hair loss as opposed to the other side. My own family is what I draw this from, where my brother, my younger brother, who's my only full brother, he resembles my mother's side of the family a lot more than I do. I resemble our father's side of the family a lot more than he does. His hair loss is identical to our grandfather on my mother's side. My hair loss is identical to my father and my grandfather's side on his side. I'm getting a real bad feedback right now.
All right, try now.
That's About the same.
I don't know why.
So that's one thing that I think is important to consider. But the easy answer is also to consider your medication use. You said that you're just starting oral minoxidil. So that's good. You got to give that time to do what it's going to do to determine if that's going to help. Are you taking any other preventive medications such as finasteride or dutasteride?
He's on finasteride.
Yeah, finasteride. Yeah, for 5 years.
Okay. Oh, 5 years. Yeah, sorry, I missed that. And how's that working out for you?
Pretty good. I mean, generic, and yeah, they switched manufacturers a while back, but I'm no problems at all. I've considered getting on the brand name now. Yeah.
Okay. Now you said it's working pretty well. Are you noticing a stabilization, or is it a slow progression of loss? Slower compared to not taking it?
Yes, probably a slower progression of loss, I would think.
Okay.
I think is probably the realistic outcome.
And answer the question earlier about the family history of hair loss. Does anyone in your family have aggressive hair loss of 5 or greater?
Yeah, it's all through my dad's side, and I'm probably going to look like my dad. I would think he's probably a Norwood 6-ish, something like that.
Yeah. Look, with that in mind, and assuming that your medication use is positive, and let's say you have a positive experience from oral minoxidil, I think that FUE is fine if that's all you want to do, but you have to be really realistic about it, because a lot of guys, when I look at their donor area, and this is something that even some doctors don't really recognize as a long-term issue, is they do have retrograde alopecia above the ears, not just in the nape, where you walk down the street and look at, pick out 20 guys and look at the sides of their scalp, look at the bilateral donor regions, if you can look on both sides, and see if you can notice that there's almost like a band of thicker hair, maybe an inch or two above their ears, as opposed to the same density going, from the ears on up to the top of their head. You'll see that a lot of those guys will have that thinner area above the ears. And then once you start to identify this, you won't be able to unsee it. You won't be able to not see it moving forward, because that'll be in your psyche now. When you're thinking about hair, you'll be noticing on other guys. So if the hair is taken from the stronger areas of the donor area and it's not too aggressive, and you are realistic as far as the numbers over the long term, like say you do have, say your crown area does continue to thin a bit, you could have moderate FUE sessions there, but don't expect it to be. Don't expect it to be enough to fill that area back to the appearance of native density. What I'm saying here is, because you're progressing fairly slowly, you could probably have an FUE now and it would look fantastic. You could have the hairline reshaped and a good density, and tap in that crown a little bit to fill that in. But as you continue to lose, if that's what's going to happen, then you're definitely locked into a second, maybe a third procedure. And the question is, how much donor hair do you have to address that? And the same goes for FUT. Like, you could still have an FUT, knock out, a good solid session, and then switch over to FUE. But ultimately, it's the same both ways. You'll probably get more, questionably, more grafts over the long term with a good strip to start. But ultimately, how are you going to want to address it as far as your final result? What is your donor capacity going to be as you continue to get older? Those are the kinds of questions that we don't know. Like, you know what you want to achieve, but
I don't think you said questionably he's going to get more grafts. He will get more grafts in the long run. I think maybe you didn't mean to use questionably, but in general, he's going to get more grass in the long run if it's a hybrid at some point. The problem is also, and this is what a lot of people don't know. Thank you for that, Joe, by the way.
Mm-hmm.
Even in a strip. Now, again, you seem to be progressing slowly. You've been on medication for 5 years. You're doing well. You're taking oral minoxidil. Who knows? I mean, that could bring back a lot of hair. We don't know. So you could end up really doing extremely well. And you may look at yourself and realize in a year, maybe I don't need surgery. That's a possibility. I'm not saying it's going to happen, but that's possible. But anybody's donor, even if people think they're removing it from a relative sweet spot, could actually get lower as they get older. So in some cases, even with a strip, if it's not taken in the exact spot that it should be taken, it's possible that some of that hair could end up miniaturizing. And it's also possible that if you really do dip in that area a lot as you get older, that a scar could become visible. So these are all possibilities. So that's why it's so important to find someone, a real specialist who I think has all the tools in the toolbox. Now, with that said, and I've said this, and I find it to be unfortunate, even in the IHRS, most physicians in the field have converted their practices to mostly FUE. And because they're prepared to do that, and because it may kind of interrupt the infrastructure of their practice to have an FUT case, not everybody, but some people, they will want to do FUE on you. They have good experience with FUE. They could bang out FUE well. They can really get good grafts. And at least in the relative short term, they know that the patient's going to be happy. That could be 10 years, 5 years, whatever. But I do think that patients in general are at a greater disadvantage today than they were just 6 or 7 years ago, because fewer really good surgeons are offering FUT now on a regular basis. So in your case, I mean, you seem like you're in a pretty good position. And if you're willing, like Joe said, to have realistic expectations down the road, you could have years of great hair to really get you through your 30s, 40s, maybe 50s. You don't know. Just with a well-planned FUE.
And I want to add to that when we're talking about realistic expectations, every time I hear that, it's like, well, what is realistic? I think the better term is conservative expectations, because that's more accurate. I mean, realistic is relative. Conservative is relative.
I will change that in the books.
But it's call up to have those chapters re-edited.
Yeah,
we'll see that in 6 years.
Yeah.
I think conservative is more appropriate, even though it's still a relative term. It's something that more people can kind of grasp onto as far as the overall meaning of how it applies to hair restoration. So, like in my case, the best way to address the way I've done things is, while I've had all these surgeries, it's still a conservative approach to my hairline design, density, things like that. So I think that might be something that would be easier to grasp onto for everyone watching and listening.
Yeah, that's very helpful. But as we know, when I'm older, I'm sure.
But what about me? Oh, I'm sorry. Go ahead.
Well, I was going to say, as we know, once I get older, I'm sure I won't care about this, right?
Oh, of course.
How old are you now? You said you were 38,
care less.
36, 34?
I'm 34. Yeah, 34. No, and that was a joke.
But I know that was a joke, and it was
first time listeners. Yeah.
Yeah, but I will tell you, 34. It is young for sure, but it's also not that young. So you're kind of like in that spot where I think you should know within the next year whether or not you're going to feel like you're really a good candidate to move forward, especially since you just started the oral minoxidil.
Yeah, so maybe give it a little bit of time and check it out. I mean, I'm not hoping for huge regrowth. And like I said, my hairline is very receded, so that's always been the issue, is just not having that framing of the face that I would prefer.
Of course. And I totally get it. But you're at a good age where your brain is fully developed for the most part, I would say. You've done your research. You understand the limitations. If it's really more about framing your face, it may be a great option for you to have surgery, especially since you seem to be doing well on medication so far. With the addition of oral minoxidil, if you have no sides and you start to notice the overall density and, your native hair kind of strengthening and some of the miniaturization process even getting, reversing even more, I mean, you could be a perfect candidate. Very few people out there your age who are considering surgery have been on medication for 5 years, who are willing to take finasteride, first of all, and who are on both finasteride. You gave that enough time to realize, okay, this works for me. I'm going to continue. And you're bumping up your game with oral minoxidil. So as far as having all the stars aligned, you are probably emotionally and medically, as far as the therapy that you're using, in a better position than most guys your age to have a hair transplant.
Mm-hmm.
Yeah, well, thank you. That's really helpful to feel like I'm on the right track, at least in some way. So, yeah, thanks, guys.
100%, man. Listen, good luck. Again, don't rush into it. You may see regrowth from oral minoxidil that you didn't think would be possible. I've seen some pretty spectacular turnarounds.
Yeah.
Awesome. Yeah, I'm certainly looking forward, and I'll give you guys an update after I have been on it for a minute.
I mean, I won't take that shit, but I'm just saying. All right, brother. I'm kidding. I'll talk to you later. Thanks for the call.
All right, sounds good.
Bye-bye. Am I? 888-659-3727. No, here's my reality. I'm so glad that it's being prescribed the way that it is now. And I'm so glad so many people are taking it so I can kind of watch their progress. I was only privy to maybe 50 or 60 cases over the years of people who are on oral minoxidil for the long term, and they all seem pretty positive. But now there's thousands of people taking it. So I'll really get a good chance to see who gets fucked up and who doesn't. No, but I prefer to be the control in these things. Look, I was one of the first at least to experiment with finasteride. That was I took a real chance as a kid. You did, actually. Yes. I didn't grow breasts that I'm aware of.
But was it really a chance? Because there's no one talking about side effects back then.
Well, the doctors originally, when I wanted to get on it, I told you the story about the one doctor who said I was essentially going to be turned female. So that was pretty scary.
That's true. Okay, so what? It was a risk. Yes.
Yeah. He said like almost 100% certainty that I wouldn't be able to have sex. That I would, and he was right about that. And just kidding. And according to some people I know, but and I mean, I would have feminizing side effects. I would lose my facial hair. I would have man boobs. He even mentioned somehow my hips could possibly grow. I would gain more fat on the lower half of my body.
Spencer with birthing hips.
Yeah. One day I will get up, and I am telling you, I'm going to be like, I'm going to look like a Dominican chick. That's not a bad thing, but I'm a man. So, yeah. But So I mean, that was back in the day when really no one was taking it. But anyway, I do like to see these guys. I like to follow their progress, and it does seem that the guys who don't experience any adverse side effects with oral minoxidil do very well on it. So I think it's kind of an exciting tool that's being prescribed a lot more often now than it was back in the day. Let's see who this is.
I would agree.
Hey, you're on the air. Who's this, and where are you calling from?
Hello.
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 Does anyone remember? Hello.
Is this Dante?
Dante, old man Dante.
Old man Dante,
wow.
What's happening, my man?
I listen every week. How are you guys?
I can't complain, Dante.
Good. I listen every week. I've had nothing to say, so I don't call. A lot of the younger guys now that have tuned in have, good conversations. So I just lay back. But tonight I do have something to talk about.
Let's do it.
Let's hear it.
All right. So I'm still snooping around for a transplant. Right at 67, I'm still not totally satisfied, and I know all the cons. Right, there's probably no pros. So I contacted a clinic. Joe did a special on them on Tuesday. I watched the special, and I was well aware of the clinic, so I contacted them, and I sent down a bunch, right? And I sent down a bunch of pictures, probably like 20 pictures, right? Because I have pretty much depleted after 6, 7 transplants. I lost count. I think it's 7. I pretty much depleted donor area, right? So I need beard, chest. I sent pictures of my chest, beard, my head. My hairline's good, but the top of my head, the middle of the top of my head going back is pretty much nothing there. So, very nice young lady. I think I emailed. I think I filled out the consultation online. Nice young lady calls me and told me what to do. I sent, like I said, like 20 pictures down. She calls me the next afternoon, very nice, and says that the doctor, who I'm talking about, I'm sure, right? The doctor said he will not do a hair transplant on you. And I said, why? And he said, because he feels that if he uses beard and chest, you don't have enough hair in that area to, I guess, it's different hair, obviously, right? And I guess I don't have enough to camouflage it from looking, I don't know, my own word, ridiculous, maybe because that's more curly, coarse, whatever. And he said that he wouldn't do it. So I thanked her for his honesty and was very disappointed.
What doctor are you talking about? And what special did you do, Joe? What's going on?
That was the premiere of the revisiting of results from Dr. Aaron Nussbaum.
Ah, okay.
On Tuesday morning.
Mm-hmm.
Yeah.
Yep.
And he gave you his honest assessment. Instead of taking your check, instead of saying, we could absolutely throw some beard hair in there.
Come on down. We'll throw some hair in there.
Yeah, we'll throw
just
some
throw
hair
some
in
hair
there.
in there.
Yep, that's not what he said.
He turned you down.
Yeah, he turned me down. Now I've had 2 other doctors, and I think, that should tell me just to end the journey.
Well, you're not going to give up. I hear it, man. You've been calling for years.
Yeah. But I've had 2 other doctors on, tell me that they could do something. But I think in my case, I really think the pictures, virtual doesn't work. I really need to be seen in person. Not by Dr. Nussbaum anymore because probably just didn't. I don't know. He thought maybe for whatever reason. I understand what he's saying, but I don't think I could do like online consult or just send pictures because they really have to see.
Well, I do think it's always a great idea. Excuse me, to have a in-person consultation with an actual doctor. Sometimes the in-person consultations are just with consultants, but have the ability to see a doctor, have your donor assessed, see if there's anything that might be able to be done, and if it's something that you really want to have done and you think it's a minimal risk compared to the possible benefit, then that's up to you. Now, this is the practice of medicine, and at least according to your images, Dr. Nussbaum felt that he couldn't help you. He couldn't get you to the point where it would benefit you. So he decided to turn you down. There may be some other doctors who might think they could benefit you in some way. I don't know. But usually when you're turned down once by a really good doctor, you need to put that into the equation and see as many other physicians as possible, see them in person, and then at the end, after all of your consultations, you have a fuller picture and a more complete equation. You can make an educated decision.
No, for sure, yeah. See, my issue is, I'm in New Jersey. If I need beard and, some beard, some chest, there's not that many I don't think doctors in my area that do that. I know there's two in Florida. Like Dr. Bauman was the other one. I contacted him, and they wanted me to send pictures. And he wanted a consultation fee, which is fine, but it was $500, which is, still fine. But
right.
I just, after
Good for
with
him.
Dr. Nussbaum, I didn't want to just, I would probably have to fly to Miami. And, Dr. Umar's in Manhattan Beach, I guess,
he's out
California.
Here in the LA area,
Yeah, I'd have to fly over there, so it could be back and forth, a lot of travel, But I think that's my only hope if I really want to do this, to just be seen in person. Because I don't think, the pictures probably even make me look better. Because, depending on lighting, you can look like you have more hair.
Yeah.
Yeah.
Well, of course.
Well, I think, listen, I think it's good that you took the step. You had a consultation, at least an online consultation with a legit doc. And, again, this could be your first step. Look, dude, you're 7 now?
7, yeah.
Jesus. 67 years old. God bless you. And you still want hair. And I think this is a really important point that these young guys need to hear. We don't feel like, you know what? We only want hair for 10 years or the next 20 years. We want hair for the rest of our lives if possible. That's it. Once we're in this game, it doesn't end. Once you have this mindset, like people like you and I have, this is what makes you feel comfortable in your own skin, and you want to do whatever you can to maintain your appearance. Doesn't go away.
No, it doesn't. And Spencer, just to add on to what you just said, I started in 92, and back then they were doing like 350 grafts was it for the session, because they were, obviously a different day and age. But so the largest session I ever had was like 1,000, and and with that I still have a depleted donor. So like you're saying earlier, 5,000 grafts, you're pretty much wiped out. And when you start to lose the rest of your hair, it's a problem for the younger guys.
Again, it is a problem, and no one really wants to talk about it. They don't like the fact that I talk about it openly. It's a problem. It's a the average case, I would say right now, for a young patient having FUE surgery, especially going overseas, is probably between 3,500 and 5,000 grafts. That's just the way that it is. It's the way these companies are able to make their money. Also, a lot of these grafts don't necessarily grow. So say even if they get an 80% growth rate, if they throw enough grafts into the mix, it's going to look like they had a good result. And then within a few years, they're fucked. That's the reality. You can do as much PRP as you want, unless you respond incredibly well to medication for the long term. Eventually, that hair is going to miniaturize because too much of it was moved from outside the so-called safe zone. So, Dante, thank you for the call, man. I'm glad you had a good consultation. It's always good to hear your voice. Again, take your time. I mean, I know we don't have much time left, but, still.
You're right. Who knows? I walk around asking people, how long you think? You think I'll live 5 years? Because if I do this, I want to at least get 4 years out of it.
Well,
right?
but that's the beauty of it. If you do it now and you go all in, you'll probably enjoy that hair for the rest of your life.
You're right. However long that may be.
Yeah.
Right. You're right. So,
right,
but I just wanted Joe. You did a nice job with that. Dr. Nussbaum's group, and I said, now I just wanted you to be aware, which I'm sure you already are, that they're not only a really good group, but they're also honest. So I think that helps also for you to know.
That's great
that
to
too.
hear. I really appreciate hearing independent feedback, reviews of experiences, especially when I hear that a clinic I work with has turned someone down instead of saying, "Yeah, let's do what we can." I've heard that before from clinics saying,
"Let's throw some grafts in there."
just to get someone in the chair, and it makes me sick. So I'm very glad to hear that. I expect nothing less because Dr. Nussbaum is fantastic at that. But it's always nice to hear that. So thanks for telling me that.
Yeah, and the other thing about it, too, real quick, is that, at my age, instead of being like 35, he figures that I could afford it, number one, right, because of my age.
Right.
Number two, at my age, I've been banged around enough that, how pissed off could I be? Not as much as a 35-year-old, right? So he really, he really thought it through, I think,
Yeah, listen, he knows you've been through the mill. You've had 7 surgeries. You are older, exactly. You have the money. Yeah, I think that was it's interesting, and I think that it's really important that you called in to tell this story, because I'm not saying other doctors aren't going to say, yeah, you know what, we can help you. Like you said, they may think they can, but it's always good to have one person turn you down. My lighting is going nuts. One person to turn you down, just to kind of put that into your equation, so you know that maybe this isn't the right move. But then again, like I said, at our age, man, what the fuck do we have to lose?
That's right.
All right, Dante.
All right, guys.
All right,
great talking
care.
to you guys as usual.
You too, brother.
I'll be back in touch.
Great. Take care. Bye-bye.
Thanks,
You
brother.
too.
Bye-bye.
Thanks, Joe. Take care. Bye.
Phone number, 888-659-3727. 888-659-3727. We're here to take your calls. All the lines are lit. So if you get kind of like this weird voicemail, it's not really a busy signal. That means that phone lines are busy and you should try to call back. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
It's Morty from Brooklyn.
Morty from Brooklyn. What's happening, my man?
Who?
Hey, guys. How you doing? Who? No. That's Joe from Staten Island. Guys, how you doing?
Look, if you start calling more often, maybe we will have an opening made for you.
Oh, all right. I'm going to have to work on that
All
then.
professional like. So what's up?
Well, I'm calling because of a story that I relayed to you separately, and it had to do with an experience that I had while under surgery. During my second surgery, probably about 2 or 3 hours into it, you're sitting in the chair for a few hours, and you have the urge to use the bathroom, right? So told the doctor, I got to go to the bathroom, and then when I go to stand up, I felt a little dizzy, and then once I stood up, the doctor asked me, he asked me if I was okay, and I said that I felt a little bit dizzy, and when I said it, I was slurring my words. He immediately said, "Don't get up." He basically sat me down in the chair. He put my head down and he elevated my legs. And and I sat in that chair for probably a good 10 or 15 minutes before he gave me the permission to stand up and then go and take a piss. So,
well, let me ask you a question. Did you have any tingling of your tongue or mouth at all? Did you notice that obviously you're slurring your speech, but did you notice when you got up and you were dizzy, there was some sort of feeling in your mouth?
Well, again, this was in December of last year, so it was some time ago. So the memory's not all that clear, but I don't remember anything along those lines. But the funny thing was, when he told me I was slurring my words, I didn't notice that I was slurring my words, which was also sort of interesting.
Right. Well, that happens to me all the time. But anyway, go ahead.
But anyway, after that, I decided to look up this condition called it's called oh God, I can't remember what it's called, lidocaine toxicity.
Right.
And I figured I would ask the experts, A, do you think I was suffering from it, and B, how often does that typically happen, and C, how dangerous is it?
I would say that it sounds like, especially with your slurred speech, that you're having some sort of reaction to both the lidocaine and possibly just your position in the chair for so long, and maybe you're having blood sugar issues. But honestly, that sounds like, and I'm not a doctor, kind of textbook lidocaine toxicity. You would normally have some sort of in many cases, almost like a dulling feeling or numbness to the tongue. which could be why you were slurring your words. Joe, what do you think? You're in the OR a lot.
Yeah, that's actually what I was thinking. And the question I have is, were you being injected multiple times during your surgeries where the doctor or whomever was giving you the injections was saying, you let me know if it's starting to wear off because you're burning through it quickly or something like that? Was there some sort of discussion about that where you were burning through the anesthetic faster than average, or there was comments about how, or were you complaining about pain and they were saying, well, that's unusual, let's give them some more? Anything like that?
Well, again, I'm trying to remember here. Going back to it, I mean, I was told, they did the ring block where they basically, they go around the periphery of your head and they inject all the way around the head. And the first time I did it, I got what felt to be I had a sort of a heaviness on the top of my head, like I was wearing a helmet, that kind of a sensation. The second time I didn't feel that degree of heaviness, but the flip side was that the second procedure was a lot smaller. It was only about a little over 1,600 grafts. I think 1,624. The first one was bigger, and it was actually over 2 days.
Right.
But they told me to let them know if I was having any pain. And to be honest, I didn't really have any pain. I was feeling pretty good.
All right, now let me ask you: were you on any other medications, antihistamines, beta blockers, anticoagulants?
Well, let's see. So I'm kind of a health nut.
Antidepressants?
I do take an antidepressant. It's mirtazapine. I take a piddling dose, like 2 milligrams, 2.5 milligrams. I take.
There's a stronger chance of having lidocaine toxicity when someone is on those types of antidepressants. So that's something that definitely has to be put into the equation along with your weight and your dosage when you're injected.
Yeah. But I mean, like I said, at the end of the day, the time passed and everything went smoothly after that. But it's one of those kind of questions that when you start to look deeper into it, you start to wonder, if that is sort of like, normal operating procedure.
No, it should be rare. It should be rare in someone's practice. I mean, it's going to happen for sure, but it shouldn't be something that happens on a weekly or a monthly basis. It should be something that a physician can count on one hand during a year.
I see. Okay, that's interesting.
Yeah.
All right. The reason I ask has to do with the fact that I know of at least two other patients to that same doctor who have, who I know one of them basically told me they had the same experience where they had to have their legs elevated, and one other one who basically was told during the last 2 hours of their procedure that they couldn't have any more medication because they had maxed out on their medication. Yes.
That's
I'll let Joe speak to that. That's what he was going.
That's where I was going.
Yeah.
Because if you if there's discussion about this, because some patients they just they burn through the anesthetic faster than the average patient, so they're metabolizing it, they're processing it faster. Well,
that was not me.
But that's where I was leading with this.
Please let Joseph talk, for crying out loud. I'm just kidding, Morty.
What, Morty?
No, I'm just saying that's hearsay.
Yeah. Okay. Well, look. I don't know what's going on with the other patients, but that is indicative of someone that's well, it can be. I'm not saying it's an absolute, but it can be indicative of patients that have had too much anesthesia during a surgery. And I've actually seen cases where the doctors pulled back and said, you know what, we're just going to go ahead and slow down and wrap this up a bit sooner because we can't keep going with giving anesthesia just to get to a certain number. They've actually stopped the surgery. wrapping up with what they have and then finishing it up. But yeah, that is a potential issue, and it's a potential reason why you're having that issue.
Well, here's the good news: you're alive. I mean, you could have dropped dead.
Yeah. And this is one of those things that's funny that people often forget that this is surgery. This is not some sort of, day at the hair salon. And people need to remember that. There's risks associated with them, and one of them basically can be the anesthetic.
Now, let me ask you a question. Was the anesthetic used with like your typical syringe? Was it used with like a pump system? I mean, there's all types of variables that could, I think, add into people having these or these reactions being more prevalent, let's just say.
Yeah.
And again, I'm not playing doctor here. This is just from 26 years of experience and hearing it all. And also speaking to doctors all the time about what they're doing.
Yeah. To answer that question, it wasn't like an IV kind of an anesthetic. There was a needle. However, there was I guess you could call it a system of a trigger based pump fed injector.
Oh, so he's pumping it out of a bag that he uses for multiple patients.
And in that way, you can the doctor can administer the anesthesia quickly because it isn't a matter of having to have multiple syringes handed over. It's just inject, pump, inject, pump, inject, pump, inject, pump, and that way you get through the whole ring very quickly. And I mean, that's a very smart way to get through that particular stage of the procedure quickly. And I don't think necessarily that's necessarily a bad thing.
I don't think so either.
A unique thing. Yeah, no. I think it's a unique thing that I hadn't seen before.
Yeah.
It's one of those little things that you kind of remember, and you guys. I always want to call in to try to provide something new with the call, and
Well, I do think it's interesting.
You do a great job of it.
Again, it's hearsay, so I don't know. I'd have to speak to these patients, but I do think it's interesting that it's happened to you've spoken to patients that's happened to as well, because that is not usual. That is something that I'm telling you. A lot of docs would go into, I'm not saying a panic, but they'd be pretty concerned if this is something that's happening on a regular basis for them. They'd be like, wait a second. Maybe there's something wrong here. I didn't ask you this. Were you given a diazepam or like a Valium prior to? You weren't. Okay.
No, I was not. And again, I think part of the reason for that is that I came in cool as a cucumber. I was not nervous or anything. So I don't know how it is with other patients, but I know that I came in pretty cool as a cucumber. I had a lot of trust in my doctor.
Even if I was cool as a cucumber, I'd still ask for the Valium. Yeah. I'd save it.
I was going to say, you can do that. I'd just take it and sell it later,
Bring it home for later. All right, Maury. Well, listen, the bottom line is you came away with a great result.
Yes.
And I'm happy for you, man. And I'm glad that you didn't drop dead on the table.
Yeah, that was a good part of the surgery. The fact that I'm still alive. Yeah.
Well, let's face it, a man of your advanced years, anything could happen.
This is true. Well, you're talking to Dante in 67. So.
What do you say?
I said, you're talking to Dante, 67, and you're telling me a man of advanced years at 54. Okay.
Well, here's the thing. At Dante's age, he's at such an advanced age that he should just go for it, whatever. You want to tattoo your entire head with like a snake head? Do it. Whatever. You're almost 70. Life is short.
All right, fellas, listen, I'm going to let you go. I'm going to just tell you that you guys are my bros. Love you to death. Keep on doing what you're doing.
Dude, we will. You're our bro. And thank you so much for the call.
Back at you.
Take care.
All right.
Later. See you, Morty. Bye. Take care.
Phone number is 888-659-3727, live from Los Angeles and Vancouver, British Columbia. This is the Hair Loss Show. We're here to take your calls, answer your questions. Jesus, I need some water. About anything and everything hair loss. And, we really do focus a lot on hair transplant surgery because it's the most dangerous aspect of this field. That's just the reality. Yeah, the other sides of the industry, you could be ripped off. You could, lose some time. I guess it's possible if you were just going to get PRP injections with anesthetic that you could be harmed. But in general, it's surgery that's really going to fuck you up. So that's what we concentrate on for the most part.
Yeah.
888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hi, this is Isaac from the UK.
Isaac from the UK. How are you, man?
Hello, Isaac.
Yeah, good. Thanks for having me on, guys.
You got it.
So basically, just to give you a bit of a lowdown, I'm 27 years old and I'm looking to have a hair transplant in January. The complicated part about my case is that I've tried finasteride. I was on it for 2 years, then got mild gynecomastia. So the doctor said, get off that. So I did. I tried topical finasteride, had the same problem. I've tried minoxidil.
Really?
I've used minoxidil for years. And I had with that headaches, terrible headaches. So basically, I've tried pretty much everything you can think of. Topical dutasteride as well. I've just tried trying to see because I heard that had a higher molecular weight, so it might not go systemic, but it did. Same thing, inflamed the gynecomastia. So here's the kicker. I haven't stabilized the loss.
Right.
But I really want to get this hair transplant done because I'm getting married in July 2025 and I need it all to be grown out. But I'm getting a bit of, there's the time is closing in.
All right, let me ask you a few more questions. Before you were taken off or decided to discontinue your finasteride, did your doctor suggest that maybe you titrate the dosage to see if you can tolerate a lower dosage and not deal with any of these side effects?
We did do that. I went down to a quarter every day, so a quarter of a milligram, 0.25 milligram, and still got it, just very mild. It's like you get a sensation, and it's like permanent now. It won't go away. It's barely noticeable, but it's something that I definitely don't want to push.
No, of course. I mean, it's unusual that you're that sensitive to such a low dose, but it happens.
Yeah,
for sure. And I'm glad to hear that your doctor was knowledgeable enough to try to have you titrate to see how you do. I will say that this is not a great position to be in, to be completely candid. I know that you want to get the hair transplant. When you say that your hair loss isn't stabilized, how far have you progressed at this point, and how fast do you think you're progressing?
I think it's got quite a bit worse recently. The crown is pretty full still. The mid scalp's good. It's just, in fact, it's just, I've got the island basically, the island going on at the front. The temples are very, very thin now, and a little bit thinning in the mid scalp. So I'm thinking I could get that done initially. And what I've been looking at is really looking into doctors on the ISHRS website who do really good donor management. So I'm thinking if
the ISHRS or the IAHRS?
ISHRS.
Okay.
Which one? Yeah, ISHRS.
Okay, so just so you know, the ISHRS is really just an educational organization.
Right.
Anyone who has an MD or DO, whether they have real experience or not, they're able to join and become a member, and it's kind of like a trade organization.
Okay.
So,
that's worth knowing.
Yeah. So just be careful with that. Not everybody who's a member of the ISHRS is, has a lot of time on tissue or has the skill set to be able to help you or even to guide you in the safest possible direction, in my view. It's important that you know that if you're progressing now and you're 27 years old and you can't take medication, whatever hair you have moved, I mean, if it's moved 100% from a relatively DHT-resistant area, it may last for a while, but you will continue to progress. And it's unlikely that you're going to enjoy a full-looking head of hair for very long if you are not managing and able to somehow manage the progression of your hair loss. So surgery could be very disappointing for you. Joe?
What have doctors told you that you've consulted with, assuming that you have consulted with doctors?
I have. I've actually been going to a trichologist actually as well. So she's been quite good. She put me on, it was a Philip Kingsley mix. So it was an anti-androgen, but it wasn't topical finasteride, and it had estradiol in it, basically some sort of estrogen anti-androgen. And that seemed to be working, but again, the same flare-up. I think I was just super sensitive to anti-androgens, which seems to be the case. At the moment, my regimen is I'm using a dermapen with Capilla longa, and also taking saw palmetto, which I know isn't super effective, but it's something. And just seeing how it goes from there to try and slow it down at least.
Now, you're not having any adverse effects from the saw palmetto?
You're in a position where you're.
Go ahead, Joe.
I understand that you're in a position where you're trying to really find an answer for you, but my problem with what you're going through is you're wanting to do this for your wedding. I get it. But what are you going to do 2-3 years after you get married and you're struggling with these gaps in your hair loss that have developed? Your hairline's been reestablished, but the forelock that you have now has disappeared. Your anterior mid-scalp is thinned out. Like, how are you going to deal with that if you have to continuously go back in for more surgery for top-ups to fill in these gaps, which eventually there will be no more hair to use to fill in with?
Exactly that. So this is the thing. I'm almost predicting I'll become, a Norwood 5 like my dad is. But he's hopefully, he would have a relatively strong owner area. So I'm really thinking that I need to be super, super strategic about this and go to a doctor who can measure as many follicles as they can, and see what kind of coverage. And I know it won't be fantastic for my whole head of hair, but something just be super conservative with what they use. And hopefully spread it out over years. Probably, I think I probably need 3 or 4 hair transplants.
Well, yeah. What you need is that makes sense. The question is, what do you have in the donor bank for those 3 or 4 procedures? My concern is that you're going to regret this because no one wants to keep chasing additional hair loss. And look. Let's back up and look at this from the current situation you're in. You're engaged to a woman that loves you. We hope. You're looking to change your aesthetic for something that she's already agreed to marry you, man. And you're wanting to, and I understand why you want to do this. And in fact, in some cultures, it's almost mandatory to go through something like this before you get married. But it's not in your culture, assuming probably too much.
Yeah, it's not.
But you were in a position where you've already got what you want. Why alter things now to get something to shore up what you already have? Because that's what it sounds like. It's like I want more hair for my wedding. Why? So you look good for your wedding pictures?
It's not just for the wedding. Ultimately, it is for me. But it's just so that I do want the hairline restored for that. It's completely for me. I just can't. Like every guy on this forum probably feel like they really don't want to go bald. They really don't want it. And I definitely don't have the head for it either.
Let me ask you a question. All right. So Joe made some good points. So you have a woman. You're going to you want to go down the transplant road. This is going to cost you money.
Yeah.
How comfortable is she going to be when you guys are trying to pay a mortgage at a young age, and you're every year or two you have to go in and have a hair transplant? That's number one.
Yeah, I mean, I think that is something that I'd have to look at. But at the moment, financially, I don't think it will be an issue.
Okay,
but
well, that's
of course,
good.
like anything, you can't predict the future, can you? You can't predict what the economy is going to do.
But I can tell you what's more predictable. If this is something that you're open to, and it's unfortunate to me that people aren't open to this first, but if you were able to get you would probably need like a partial hair system at this point, but something that was partial that you could utilize to recreate your hairline that can look natural if you do it right. Would you be opposed to that? Because you already have the woman. You don't have to explain anything to anybody. You'd be like, look, honey, I don't feel comfortable in my own skin. Here's a great option.
Yeah.
It looks great. And I'm not a candidate for a hair transplant. How would you feel about that?
No, you know what? It's something that I just couldn't handle it myself. I wouldn't ever wear a wig. I just
You're not making this easy, man. You're not making this easy.
I know.
And that's the thing. And it's interesting the way that you say that. You would never wear a wig or a hair replacement, but you would have surgery, which is it's a big deal, and you will probably end up not. In the end, you may end up having to wear hair anyway.
Yeah, I mean, I do use Topic and things like that, so I'm thinking if I get some just good coverage, it could probably be pretty see-through, but I don't mind as long as, like, on a day that I want to, I can just fill it up with a bit of Topic or main hairspray, that thickener, just to make it look a bit good on a day I'm going out or whatever. And
I totally get it, man. And we're just giving you a fair warning. It is
100%
unlikely that you're going to be thrilled with your hair transplant. You will be chasing this. You will be chasing this for the rest of your life until you have to give up, and then you're going to have scar tissue and grafted hair, and that's it. That's what's going to happen.
There is one option, and I rarely suggest this. I'm not suggesting it in your case, but it is something for you to consider. And I will give credit to Philosophysique in the chat room. He read my mind. There is an option for you because what in the actual F is going on? It's like in Bollywood movies, kicking it in the background. I love it. What was I saying? The option for you is, let me back up. So here's one thing I've noticed over the years is patients that have a gynosensitivity to anti-androgens, they tend to have the best results, medically speaking.
Yeah.
Like, I don't know what the correlation is, but the option for you is to actually have gynosurgery. It's an outpatient procedure, usually. It might cost you a couple $1,000 if it's not covered by NHS.
No, unfortunately,
but that is an option. That is an option.
Yeah, you know what?
I mean, you're willing to spend, I assume, several thousand for a hair transplant, unless you're looking for a cut rate transplant. But you're willing to spend several thousand for hair. So why not a couple thousand to make it easier to spend several thousand on hair? The idea is you have the gynosurgery, you remove the issue that's being affected, you get on your Propecia, you get on your Avodart, whatever you want to take. Fingers crossed, it's everything's taken out and you don't have an issue anymore. You have a great result from that. Your surgery is a success. You maintain maybe one surgery in the future, maybe a second. Who knows? That's something to consider after you speak to your doctor about it. We're not doctors, but that is something that is an option if you want to be that serious about it. If you want to be that aggressive.
Yeah. You know what? I think I am, and I have thought about that in the past, and I think, I mean, that is the logical answer, isn't it? Really, It's the only real side effect I had from Propecia was that. So, you know, I probably should just try that first. But yeah, that's the thing. It's just, I'll try that.
I mean, that is actually it's a logical suggestion, but it's still like, you know, look, you're going to have surgery. So I guess, Joe, that is probably your best bet.
I see
mean,
that.
to me, it seems a lot
having
easier
surgery,
to try to glue a partial hairpiece on, see if you can live with that before you get your tits cut off, and or you're actually getting sucked out, and you know, get, you know, and have surgery. But look, what do I know?
Yeah,
you know, I get it.
No,
you're 27 years old, and this is what you want. I understand the mindset, 100%. Yeah, that's a good suggestion from Joe. So talk to your doctor about that. And if you're willing to go that far, but here's the thing: you could still get that done. You can do well on Propecia, and you can still get fucked up by the hair transplant. Just want to put that into your equation as well.
So basically, you're fucked, Isaac.
But if all the stars are aligned, you're gonna have a great life.
So, I appreciate the advice, guys.
All right, brother.
Great show as always.
Good luck.
All
Let
right.
us know what you
guys.
decide to do and how things go for you. All right.
Will do. I'll
Absolutely,
keep in
yeah.
touch. Cheers.
Okay, brother. Good luck. Thanks. Bye bye.
Take care.
888-659-3727. We tried. That's a logical suggestion. That the thing is, I would probably suggest that you start the medication first, get an idea of what's happening, what part of the glands are actually being affected, before you just have them removed.
Not to mention, and this is something I forgot to ask, is how long did he? Like sometimes these symptoms will go away on their own,
transient,
like push through, and yeah, they're transient. So that's something we didn't ask. So I would suggest that if he's committed to actually going through with the gyno surgery, then get on the medication, see just how bad it gets, and then have a better idea of what the future options are. Because it could be transient. Who knows? But I need to comment about some of the guys in the chat room. These little yawning emojis and next caller, that was a great call. It may not have been great for you, but there are so many guys out there that are having this exact same issue, and that information that was just put out there was gold because no one's told them this before. So I understand it may not be applicable to you, but let's stop it with the yawning emojis. If you don't like it, if you're bored, sorry. We're here to help people that are calling in and answer the questions.
But here's what we do, Joe. I was on the radio for a long time. There were no yawning emojis. We take calls.
True.
And we enjoy the broadcast and let people have their questions answered. And fuck the people that don't like it. That's how I feel about it. It's a radio show.
And with Robert Hellner, it's like, it's kind of funny at this point because he does it every fucking show. But there's BK4 and there's Hampton Hudson. It's not kosher, guys. They got legitimate questions and they need their help. They need our help. So just had to get that out there.
You're such a good person, Joseph. Phone number is 888-659-3727. Very patient too, by the way. Let's see this. I just ignore it. I see it happening. I'm just like, oh, God, here we go. Hey, you're on the air. Who's this and where are you calling from?
Hey, this is Rich from Queens, New York.
Rich,
how are you guys?
Queens, New York.
What
What's
up,
happening,
Rich?
man?
Was it Rich or
How
Rick?
are you guys? Rich.
Rich. Okay, got it. Good. How
Rich,
are you?
I am good. How are you, man?
I'm doing pretty good. I have to say, what Joe said, some people may be yawning at that, but there are so many people like that guy that's out there.
Oh, yeah.
The people that are in that chat room, they may know a lot more than the average person, so they think it's boring. But you are helping someone possibly not make a mistake that is, it may seem apparent to us, but to the average person, they know nothing. And they will walk in. There's stuff that you're trying to give that advice to, which, I mean, there was a lot of advice to give. He shut everything down, so it was hard.
But he had a great accent, so it works.
Yeah, exactly. You throw the accent on, it's like, that's it,
Listen, he. This is what he wants. He's a 27-year-old kid. He doesn't want to be bald. I totally get it.
I heard came into the part where it seems like he's doing it superficially for a wedding to look good for a certain amount of time. And Joe's making a thing like it. To me, it doesn't make sense because I'm like, you are getting married. This woman already knows you're losing it. I mean, it's not like you suddenly have full of hair, then you got married and then
it's not like you're fooling her or anything.
Yeah, but I think he just kind of used that as, his entree into the call. And he wanted to express that he wanted to get it done within a certain time period so that it was grown out for the wedding. Right. But the bottom line is he wants it for himself. And that makes sense.
Well, Joe smiled and I saw it when he got the answer. When the guy says, I'm doing it really for myself. Yeah. And that is a good thing when you're doing it for yourself.
And I also think it's important for all the guys who may be bored in the room. We're going to continue this conversation because I think it's an important one, Rich. But the fact that
for me, I'm saying now, one thing that I heard at the end was the gyno thing. Now, I don't. First of all, people got to know the guy's weight. Does he work out?
Good points.
Yeah, all good points. He actually said that he felt the gyno. So, I mean, when you start to feel the tingling and the pressure.
I've seen people, I can't eat muscle mass anymore because I'm on finasteride. I'm like, they hear about it. And also, you got like that gyno surgery that you're talking about, even though it's not as bad as online, they make it seem like it's hell. Like you'd rather go through 6 birthings than get gyno surgery. Yeah. That's what it's made to be online. So I'm telling you where some people see that.
Yeah.
Well, and it's made out to be something maybe, I don't know, because, I don't need that, but I'm just saying, like, I'm just showing you the fear that's out there.
Well, it's basically a kind of a form of lipo, and depending on how much growth you have, they will actually open up the nipple, make a small cut, remove any of the overgrown glands, fatty tissue.
Is this a hair loss show or a porn show?
Oh my God!
No, I'm just kidding.
It could be a porn show.
It's Friday night. It could be whatever.
But what was I going to say before you cut me off? Jesus. The partial hairpiece. So what I find interesting about a lot of these young guys, because this happens a lot, I've known young guys over the years, and they were his age. They went for surgery. They were not on meds. They didn't want to wear a wig, as they put it. But in the end, they were forced to wear a wig. Because all they had left
scars and all that
was scar tissue. And all they had left.
No, when you say it, I love I'm sorry to cut you off, but when you say it, I love the response. When you said, what about a partial? He, looked like it was degrading. That's not, I don't mean that he's above that, but not that fake stuff. I need the real stuff from the back of my scalp to there. Like, he doesn't understand that you're giving him a solution that probably will be much better for him. So all the stuff that he cannot take, things that he's unwilling to do, and listen, like you said, when they're young, everybody's young. They're thinking 2 years down the road today. They're not thinking 10 years.
100%.
Everybody, if I get to 30 and I look better, it's not going to matter. It does. But
without criticizing the guy, I think that it's reasonable for a person his age to think the way that he thinks.
It's but if you're that vain, I'm just saying, if he feels that insecure and he needs hair transplant, even with a woman that already loves him and he needs hair transplant to fulfill him, that is going to make, for some reason, you tell someone, they see it's like wig, they see it like a false, like it's like dentures,
Dude, I can guarantee.
Sometimes dentures is the option.
I can't guarantee it, but there's a good chance, especially in the UK. It's really come over here as well. But in the UK, for whatever reason, like the crazy makeup with the false eyelashes and hair extensions, huge. There isn't a woman that walks out in the street that is not wearing a disguise. So the fact that a man would feel uncomfortable by maybe adding an inch of hair to his hairline that could be removable and he doesn't have to go through surgery, that's insane to me. You know, that should be an option for everybody.
Spence, I'm 46 now, you're older, so it's like, okay, as a guy, think if you would tell me if I was, I think he's only 27 or so, you're going to think like, okay, well, I got to go where in the water, I got to watch out. What if it comes off and the wind blows? This is all the stuff that's in their head. Yeah. They don't want to deal with that. They want something final, but they don't realize it's not final. It's more like the route they're choosing is final, like a death nail to their scalp.
They don't realize that. Yeah, it can go through the surgery. It may not work out. If it does work out, it may not last for long. If it does last for a decent amount of time, they're going to need another surgery. It is a lifelong commitment. And if you're not able to maintain your native hair with medication, then you're totally effed. But Joe's suggestion was very reasonable. And if that's something that him and his doctor agree with, then that may be beneficial for him.
It may be, but like you said, you have to know, to me, like you said, it can be transient, like Joe said, the gyno.
Yeah.
Mm-hmm. You could get things, but it could also be a person who already had a little, let's be realistic, there are a lot of men out there who are not on finasteride, and they have some nice racks.
Yeah.
Okay, so it's not even part of that. You know what I mean? So that would just exacerbate. I see a lot of people who are not in shape, and, that finasteride may seem like it's the culprit, but it may just add to it.
Look, we don't know his exact situation. All I can tell you is
we don't know, but like I said, it could be it depends on how. There are people. Listen, I never discount anything from anybody because.
Rich, we're going to give you your own podcast on the Bald Truth Network.
And I don't know. Let me tell you why I called though. To be honest, So I'm starting a trial thing with myself because I'm at a thing. I'm 46. I've been on oral minoxidil now. I'm stabilized to a point where so I'm like, let me see if I could grow even more because, I told you about oral minoxidil. I mean, this thing darkens your hair like there's no tomorrow.
Yeah, that actually is a.
I still can't grow it on my face, right?
Yeah.
No hair grows on my face. I can't grow a beard for the life of me. But my arms, they look like. That's why you said something about your eyebrows because you wanted something for your eyebrows.
Yeah.
But my legs, my arms, I mean, they look like I'm you would think I was a hairy dude. I'm a pale, white-skinned guy. I can't grow a beard if my life depended on it.
Interesting. Okay.
So my thing is, I was already for many years just for skin. I'm a very vain person, so I was on Retin-A Micro for my face. It keeps it nice and clear. So it is known that Retin-A itself can be help generate some follicles.
Right.
Help with the hair loss, or be a good.
So what's the question?
To minoxidil.
So what's the situation?
Especially a minoxidil responder, they say actually helps out. It's worth it if someone is responding currently. To me, azelaic acid is what I use during the day, and I realized, okay, you know what? I'm going to do a little thing. I'm going to put 3 or 4 times a week. I'm going with a small amount of in the areas where I feel it's still thinning a little bit.
Yeah.
Where it's going to be the kind of like the Batman, like the mini Batman, if you weren't, having your hairstyle, if you were just to push it back the whole hairline, you would have, you're still going to have some the little mini Batman,
All right. So what are you saying? You're saying you're using your retinoic acid, your Retin-A.
I use 25% just on the areas where that are still slightly thinning.
Okay.
And azelaic acid, 15%. It's
how long have you been doing that?
Topical DHT.
And how long
I've been doing it for around 2.5, 3 months, and there are some, maybe even longer.
Are we actually on the same call? Can you hear me, Rich?
Yeah, I can hear you now. Yeah.
Okay. So what exactly? How long have you been doing it, and have you seen any results?
Yes, I'm starting to see hair on the hairline is darkening where there was like, peachy fuzz a little bit, like in areas that were long gone. So that's it. But that was with just the retinoid first. I added the topical azelaic acid because that is known as a DHT blocker. It's not guaranteed, but I noticed that my hair, the reason why I did it is because I noticed the hair in my face when I started azelaic acid and the combination of retin A together on the face, the hair on my face got coarser.
Interesting. Well, so there's a long history of these products being used in the hair growth realm. And
I just want to say, listen, I'm being the lab rat. I'm doing the experiment. It has no side effects. My scalp don't itch. I use Nizoral 2% like every couple of days.
Well, like I was trying to say, Rich, there's been a long history of these products being used with success over the years. And there were products that were made, especially back in the day, in the late 90s, early 2000s, that contained the combination of these two products, and people were getting results. So it's not a dumb idea, and you're already seeing.
Oh no, I was just sorry.
Yeah, and you're already seeing results. So I think it's a good experiment, and you may end up really shoring up your hairline.
It's like the getting darker thing. Listen, it takes time because I think all of them up. I'm not sure if it's true, but for me, I think it takes longer to show results than the topical. Because I didn't see the hair change in my arms, like get darker and everything. It took longer. Because even topical inoxical darkened my hair.
Well, it sounds like you're on the right track for yourself, man. And I think it's a good experiment.
Listen, I'm 46. I'm like, you know what? Let me give a small update. I'm doing this.
I think it's
I'll
great.
see you in a couple of months,
Listen, I would love you to call back whenever you call back and say, you know what, I grew a lot of hair back. And
next call up Howard. Then you're like, oh, he's a wolf at work. Good night.
All right, man. Listen, Rich, I appreciate the call.
Okay.
That's good information.
Just wanted to give you an update and good luck to everybody, man.
I appreciate the update. Always pleasure hearing from you.
Good night, guys.
Take care. Bye-bye.
Good night.
888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Hey, caller.
Hey there, this is Johnny from Palm Springs.
Johnny from Palm Springs. What's happening?
Hello, Johnny.
Not much. Hey, Joe. It's been a while. I haven't called in a couple of years, but I just wanted to get you guys an update. So I'm 2 months post-op from Vancouver, from Dr. Wong.
Oh, wow.
Ah, okay.
Where's that gong, by the way, Joe?
What was that?
A little inside joke there. Yeah. But yeah, it's good for you. So how'd it go? Give us the ballistics report.
Well, after hearing from Morty, I just want to give my 2 cents on my whole operation that happened, and everything went great. I can equate it to like having a root canal, to be honest, and I think the root canal was worse.
Interesting.
Okay.
All right. So you said you're equating it to, or you're talking about this because of hearing Morty's experience. So your experience was was good, completely through the anesthetic and everything.
I was blown away how I had a long procedure. I can't recall on the amount of grafts. It was like 5,300 or something like that.
Yeah.
But I was there from 6 a.m. to about 6 p.m. or 5 p.m. But everybody was great. The only thing that I had was that because I sat in that chair for so long, for about a week, I had complete random numbness in my forearm because I was sitting in that chair.
That's interesting. So you felt, did you have some sort of nerve compression or?
Yeah, and that was just my own kind of research on Google after wow, this is kind of weird. Why am I getting this weird numbness just periodically? And then sure enough, yeah, it's from putting too much, just sitting somewhere for a long time on your elbow.
Interesting.
Yeah.
Interesting.
So after a week or so, it went away. And so it was fine. I didn't even ask the doctor about it, to be honest.
I'm glad. How old are you, by the way?
35.
35. Okay. So did you have, was it a full FUE procedure? You have FUT? What kind of procedure did you have?
I had FUT, and honestly, I know a lot of people say different things about it, but I was blown away how great they were. It was amazing.
Well, that's their specialty, man.
Right on.
I know
Well, good for you.
They offer FUE, and they've been doing it for a long time. But I mean, look at Joe's head. Look at this guy.
I know.
You know?
Well, I tried to hit Joe up before the procedure. It just didn't work out because I know Joe, you took off for like a week in August, and I was going to call you on your show to say, hey, let's meet up. But it's okay. I went to Stanley Park. I walked around. I went all down to the Gaslight area. Yeah, it was fun. I had a good time.
Well, listen, I'm glad you had a good experience. You went to a great doctor, even though he always bitches about how much money I make for some reason. He's a good guy, and he's a good doctor, and he's been helping people for a very long time.
Well, exactly what Joe says about him, about being a humble guy, just very nice, is to the T. He was a great guy. I can't say anything, bad about him. He was amazing. And the whole staff was just, they were great. They were just, I'm asking questions like, hey, what are you guys doing? And they were showing me everything. It was fun.
I'm really glad.
Okay.
It's so nice to hear somebody who had a good experience. And I know I don't know for sure, but I'm pretty confident that you're going to come away with a good result.
Thank you for saying that. I'm going to Norwood 6. I sent Joe photos a long time ago, but if there's any advice to give to that 27-year-old, it's just to wait it out as long as you can. Where I'm at, I'm pretty much steady. There's not anything else that's going to happen. Who knows? But from where I'm at, it's been like this for the past 5 years.
Well, listen, I think that's great advice. That's extremely sound advice to give this kid. I hope he's listening. But
I was in his exact situation. I was 28 when I got married, and I was thinking to myself, man, I wish I could do this and that. And I said, screw it. Who cares? This is the way it is, and let's just keep living and just keep going on. And then, if it comes to it where I get the opportunity, I'll go for it. But if not, whatever.
And here's the beauty of it.
That's a good attitude.
Your wife's been used to you the way you look now for a long time. You guys
Exactly.
are probably still in love.
Exactly.
And she's going to get a new man in a few months.
That's right.
All right, brother.
Well,
she gets to trade
away
up.
by the. Well, the funny part is when they put all the little graphs in. She goes, "Man, you look pretty cool with a buzzed head. I didn't think that's how you look like." But obviously, I was missing a lot of hair. And she goes, it wouldn't have been the same had you not had the procedure.
Yeah, well, and that's
Of
the
course.
thing, and you actually might be able to, even with a strip scar, you may be able to buzz it relatively short and maintain that look if you really like it.
Mm-hmm.
Actually, I might actually do it. I mean, I like long hair, but I was kind of digging it. I mean, to be honest, with not having to worry about that wind outside, my God, that is just freedom.
Yeah, I mean, I fixed that with a ball cap. That's my only fix for that. All right, brother. Listen, thank you so much for the call.
Okay, well, it was great talking to you guys.
Oh, you too. Good luck.
All right. Thanks
Congratulations.
for calling.
Okay,
Congratulations.
Bye-bye.
All right. Thanks. Bye.
Phone number 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Michael.
Michael.
Hello, Michael.
Calling from Washington State.
What's happening, Michael?
Yeah, I got a question. I noticed there's something funny about your number. Every time I call it, or frequently when I call it, it goes to somebody else completely, or a voicemail.
What do you mean
Kinda
by
weird,
somebody
huh?
else?
I don't even know who the lady was, but I know I dialed the correct number that I just dialed now, but it went to some. I just gave up. She was anyway. I don't know. It was odd.
If it went to some lady and she's answering my phone, I want to know who it is.
Yeah, I'll try calling it again.
It's your
See who she was.
it's your other sex line.
Yeah. So what's happening, man?
I was just wondering if that 27-year-old guy that called, I missed part of that conversation. If his hair he wasn't on Proscar or whatever, finasteride, and his hair loss was stabilized at 27, would it still be kind of dangerous for him to proceed with a hair transplant if it
It would
seemed
be
like
it would be a lot less dangerous, and he has a much better chance of having a longer term good result, especially if the hair was taken from a very, relatively specific area in the occipital region, and partially, perhaps on the sides of the scalp to some degree, but that sweet spot. So yeah, he'd probably be fine.
I missed part of his conversation, but maybe he was saying his hair was going at lightning speed or something. I missed that part, but
he didn't say lightning speed, but he said he thinks that he's going to progress based on his family history to about a Norwood 5. He is 27. He has a significant recession of his hairline, and he can't take meds right now. So that's the issue. Now, if he was doing well on medication at 27, I still think it's a little young to go like full blown. So you would want to find someone who's willing to do an appropriate procedure for a guy that age. But he can definitely, if he was a good candidate, doing well on meds, he'd probably benefit from a hair transplant with the right doctor.
Mm-hmm.
Yeah, as far as the gyno kind of excuse he was using or the concern he was having, I had that done myself. I mean, I wasn't.
You had your tits cut off?
Yeah, well, not really. I mean, like Spencer was saying, there's fat and there's glandular, and mine was basically just mostly fat.
Okay.
But you obviously want to find a doctor who knows what they're doing. It's done a lot of them, and the biggest thing to worry about is not having the doctor remove too much fat or too much gland tissue, or it would look really bad.
You basically
That's
have
the
it
biggest
indented
concern.
like a hole in your pec.
Exactly.
Concave moobs.
Yeah.
Yeah. I mean, basically, that's why I called today. I'm just
I
listen in every few weeks and just hoping something comes up. And I listen to you guys. So
well, I've been doing this for 26 years, and so far, not much has changed. So
yeah. Oh, one last thing. Yeah, Joe. A few minutes ago, I saw you looked like you were fighting off a fly in your studio. You were like,
no, there's I was hearing some drilling and hammering, and I was like, what the hell? Like it was quite loud. I could hear it in my studio, and so I took out my earpiece and I was just kind of trying to listen just how loud it was. And that was it. No flies.
Yeah. It looked pretty
I fumigate.
funny. All right, guys.
All right, brother. Thanks
I'll
for
let
the call.
you go.
Take care.
Thanks for the call.
All right. Bye-bye.
888-659-3727. We did start a little late, so we'll take your call. If that's okay with Joe, of course.
It is okay with me.
Okay.
Yes.
Hey, caller, you're on the air. Who's this and where are you calling from?
It's Hamp Daddy from the ATL.
Hamp Daddy.
Hamp Daddy. I like that. That works.
Hampton Hudson. What's going on, my man?
Hold on a second. Hold on. Okay, go ahead, Hampton.
I wanted to clear up the yawn. So if you scroll up, I actually yawned much earlier in the cast, and it was actually in reference to something Spencer said at the beginning of the podcast.
Oh, I caught that. Don't think I didn't catch that mother effort.
And he kind of said, I don't know who he was referring to, probably just the masses, but you had a good result, you got a transplant, move on. something along the lines of that. And I'm just here to say that it's not that simple, at least for me. You know, just because you had a decent result or a good result, you know, you're still a hair loss sufferer, and you still, you know, are fucking taking pictures of the top of your head and rubbing topical or taking whatever, you know, preventative that you're taking to preserve your hair.
Yeah.
So,
Well, that actually
the maintenance, exactly.
That makes a lot of sense, but what I was referring to was a very particular person, not all hair loss sufferers, who is claiming that their life has changed completely. They are all good, that their hair is completely stable, and they are excited about their procedure. And, you know, if that is the case, if they're not the typical hair loss sufferer, if the guy that has hit the home run in Turkey, as he claims, these are the guys who usually move on. I don't know too many of them.
Mm-hmm.
So
no, I agree that most people it's progressive, and it's gonna keep getting worse. And there's a select few that can probably get away with a transplant and a good result. I know I'm not one of them, but
well, what's your situation right now, Hampton? I know you had one procedure, right?
Yeah, I had about 2,700 grafts, just under 2,700 grafts. I was probably a Norwood 3 Vertex, early Norwood 4.
Okay.
And
how old are you now?
Yeah, I'm 29.
Okay.
And November 15th is exactly a year.
Oh, Mazel Tov.
Okay.
Oh, don't tell him I said Mazel Tov. He doesn't like that word.
Oh Lord!
But I'm glad things went well, and I do want to reiterate that I totally get. I mean, you don't have to yawn, but I totally get your point. Most people who go through this process, once you cross that line into you're part of this fraternity, you're in it for life, man. So there are plenty of people that have had multiple surgeries. Even if they've done well on finasteride over the years, they've been listening to this show for almost 30 years.
It's therapy.
Yeah.
It's therapy. That's exactly what it is.
I appreciate that, man.
I'm fist pumping in the club right now, but I'm drinking a beer, pacing my living room, watching you guys on the TV. So.
Oh, that's cool. That's cool. Well,
right
I'm glad that you called, and I want you to know something that. If you give us a little shit, we give you a little shit, but we also know that you're a brother of the show and you're a fan of the show and you're a hair loss sufferer, man. So we're all in this together.
Yeah.
Part of the tribe.
I wanted to touch on one more thing. You know, Morty called in and he was talking about an experience he had. And I actually went to the same doctor and I experienced something similar, but it was of no concern really to me, you know. Throughout the process of the 8 to 10 hour procedure, you know, I was sitting there for a long time.
Yeah.
It was no concern until you heard that Morty had the same problem.
Well, it's not a concern because something you said rang with me, Joe. Fast burners, and that's me. You know, I was burning through that shit like nobody's business because I could feel the transplant. So to me, that tells me that just pumping people full of lidocaine because I was feeling it. I was feeling the procedure a little bit, nothing crazy, but you know, I was burning through it fast.
Yeah.
And, you know, like I told Morty in the past, I get busy walking in a grocery store, so it wasn't.
Well, listen, I'm glad it's nothing serious. I mean, from what Morty explained, it sounds like it's possible some degree of lidocaine toxicity, but that happens. It's not supposed to happen on a consistent basis. He made it seem like it may be happening more consistently than it should. I have no idea.
That's why I wanted to touch on it, because I was actually feeling some pain, and I mentioned that, hey, I kind of feel it, and that's when they decided to put more in me. It's not like, to me, if I was totally numb and felt some type of way, that might be a sign of something more, but I didn't feel, I felt pain, and that's the only time they injected more lidocaine
Well, the issue becomes, you know, how many times did they inject more lidocaine over a certain, you know, a given period of time? Like if it's 3, 4, or 5 times throughout the surgery, that's about average. But it also depends on how much they're re-administering to you, because it's not going to be the same. Well, it's not going to, by standard, be the same that they gave you initially at the beginning of the surgery. It'll just be little top-ups here and there based on your weight and, you know, all these different factors that go into it. So, you know, it's not something to be concerned about in general, because if you're feeling it, it would be more of an issue if there was lidocaine toxicity and the patients are just laying there, just enjoying the surgery or, you know, watching a movie or whatever, and not complaining. But if the patient's complaining, saying I'm feeling what's going on there, then that's completely normal.
Yeah,
it happens. Like it happened to me a few times during one of my
I would say you're better off saying, you know, getting to the point where you're feeling a little bit of discomfort, and then you want more than them, you know, over medicating you at the beginning.
Gotcha.
You know.
Yeah, and I can attest to what the previous caller stated. You know, it's definitely not as bad as wisdom teeth removal. I think that's what they were saying.
Oh yeah.
Or root.
Absolutely. But I mean, there's that case of the Chicago doctor that killed somebody. But whatever, you know. I mean, shit happens.
But whatever, you know.
You know. But you know, I do think it's
hypochondriac that.
What was that?
I said, don't tell a hypochondriac that. That's me.
No, but you listen. You had a good procedure. You're happy with the results. You had a good experience, and that's all that matters, man. You know, it really is, and you can't worry about, you know, like if you start talking to former patients about their experience, unless it was something crazy, then it's really, I don't think it's any type of a concern.
I've got a question.
Actually, it's zero concern unless you're talking to another patient and they talk about some sort of communicable disease that they picked up at the clinic. Then it's something to be concerned about.
Yeah.
That's a concern.
Or if you don't understand why you're hurting downstairs for some reason, and the other guy has the same problem.
or if you're given some medications and you pass out and you wake up with your pants around your ankles, you know, those are questions.
Yeah.
You
that's
know,
real.
Those are questions. So.
So what else? You said you had another question.
So again, at the beginning of the show, after you made the statement that you made that I yawned at, whatever, you talked about, you know, donor hair is not going to last. Wouldn't you say that good surgeons are cherry picking, especially in FUE, they're cherry picking the grafts that look the best per se, that they see least likely to miniaturize over time? I know the surgeon that I use straight up told me that there's no such thing as DHT or definitely resistant but permanent hair, that all hair can miniaturize potentially. That was making me.
That's correct. But there is a true fact of the theory of donor dominance that was actually proven. So there is a dominant area of the scalp for most balding men that will grow to some degree, some aesthetically appreciable degree, for a very long time. So that hair it's let's put it this way, it's more DHT resistant and more resistant to inflammation than the rest of your hair.
And let's not confuse the issue of miniaturization versus senile alopecia, where, you know, miniaturization would be from continued exposure and reaction to DHT, because they have a sensitivity to DHT on the cellular level, whereas senile alopecia is simply the reduction in diameter of the hair shaft as one ages. It can look the same, but they're not the same.
Right.
So that could also be a factor over the long term.
And you also have so many anagen phases in your lifetime. So that's part of senile alopecia as well. So the anagen phases, as you get older, they don't last as long. And the hairs actually do become miniaturized, but it's not necessarily because of DHT. It's just time. So
just aging.
Yeah.
Got it.
So, I mean, I would say that Cole is right, that's your doctor, about all that stuff. And that's stuff that's really not talked, it hasn't been talked about a lot by physicians. It's something that I've talked about forever, that certain doctors didn't want me to talk about at the beginning of my career. You know, my whole thing is there's no hair transplant that will last a lifetime, at least the way in which it's being sold. That's just reality. But you're a young guy. I mean, your hair transplant can last you. I mean, you can get 30 years out of it. Who knows?
Yeah. Yeah. Well, not without being on meds for the rest of my life, and it's something that you definitely gotta you gotta know what you're getting into before you throw money around, dive into something as serious as this.
And how many people do you think really know what they're getting into? I mean, they find us, they get an idea of what they're getting into. Some really listen, some don't. But in general, people don't know what the fuck they're getting into, man. And that's the sad part of this field.
Yeah.
Well, Hampton, listen, thank you for taking the time to call. You should call in more often. And you could yawn on the line with us, so at least we have some content.
For sure. Yeah, man, I'm a huge fan. Y'all are helping me get through it, and I hope you keep doing what you're doing for sure.
Oh, I'm not going anywhere. I know there's one person that wants to see me disappear, but that's not going to happen.
Hey, can y'all cut out that part that I said?
Yeah, we can't get out shit.
No, man, it's out there.
All right, brother.
It's an inside joke, by the way. So I'm just kidding. But
No, we get it. We get it. We appreciate you, man.
All right, Hampton. Thanks a lot. You take care.
All right.
Thanks for the call.
See you, buddy. Bye-bye.
People are so nice when they're actually talking to you. I mean, it makes all the difference in the world, the way real communication, either face-to-face or on the phone. I mean, we become human. We're human beings again, as opposed to just, words on a screen posted to each other. And I actually think that's what's
pretty amazing, isn't it?
I think it's really something that makes what we do unique, continuing to do a live calling internet broadcast instead of just doing a podcast. Having the ability for people to speak to us, hearing their humanity and what they're going through, and them realizing, hey, these guys are human beings as well. Maybe we won't just, trash them for the fun of it.
Yeah.
Maybe they're actually trying to help us.
Maybe.
That'll never happen.
Not really. Screw you guys.
Fuck you guys.
See, I wasn't going to go there, but you did. You did.
But when you read stuff online, like from this from this doc down south, and the way that things are kind of like put into this bizarre little box of recommended doctors and all the happy horse shit that these guys think about, as opposed to what we really do. Like Hampton just said, look, you're helping me get through this, man. Or this is like therapy or whatever.
Mm-hmm.
That's what we do.
That's what it's about. Yeah, that's what it's about.
I don't fucking recommend doctors. I mean, that is such a... To distill what we do down to that bullshit, it shows a level of ignorance that I can't even... I mean, it's surprising to me.
Yeah, I know.
That someone with a medical degree would actually think that way.
Well, considering also the messages that were being pushed out by this person over the past 4 years about how...
we're the greatest thing since sliced bread.
Yeah, of course. And the message that we're pushing out. Like, I remember very specifically, he was talking about the message is being pushed out, lives are being changed. Everything that we've been talking about was being repeated as it should have been. But now suddenly we're the devil. So, what do you do?
When you reject somebody,
you keep dealing with facts.
When you reject somebody with that type of a disorder and personality, that's what happens.
Mm-hmm.
Something happened in this poor guy's life. I don't know at what point in his life it all, he formed in this way, but he was pretty young. I can tell you that. Because I was just just for the fuck of it, and I told you this, I'm like, let me check out some of these emails. I went back, I think the emails that I was able to get on this, and I have more, but on this server, whatever system, or it went back to 2009. And I can tell you, I honestly think that I can turn these emails into some sort of a documentary or some sort of it really is. I've never seen the level of rage, complaints, anger, expression of guilt, apologies, remorse,
contempt,
and then rage, anger, defaming of colleagues, and then remorse.
I think it'd actually be better served as a paper on the psyche of some people in the industry.
But there were maybe 10 like normal
research
emails,
paper.
basically, trying to talk about something that was going on, whether it was, whatever in the industry. Everything else. And there must have been 75 emails. I was just looking at the titles and capitals, and they were sent to me at like midnight my time, which was like 3 a.m. on the East Coast.
Yeah. Yeah.
And any time we had somebody on the show that it was somehow a threat, like our friend down in Florida or another guy in the Georgia area, it was like I would get these crazy emails. I don't know why you promote this guy. He does this, he does that. It's like, holy shit, leave me the fuck alone already. Leave me alone.
Not going to do it.
Anyway, it is funny, and it's actually, and you look back at it now, it's fun, and I have to tell you that I am so relieved to no longer have to field those emails or texts or late night rants out of the blue.
It is nice. It is nice. I agree. You got more of them than I did. And I got
Oh, my
some.
God. I'll send you the files if you just want to have fun. It's unbelievable. And they're long. They're like 2 pages long, some of these things. And the shit, just the shit about, like, basically it's like an essay. Here's why I'm so great. First of all, I invented the wheel. Secondly, who do you think discovered fire? Who do you think discovered fire?
Yeah,
it was me.
Fire. Yeah. Yeah.
That's the tenor of all
these
emails.
other device manufacturers wouldn't be able to forge their instruments if I didn't actually make fire.
Right. Holy mother of God. If it wasn't so
Good
insane.
night.
I mean, it is funny though. You gotta laugh, man.
Yeah, of course.
You gotta laugh.
Of course.
Oh, cut the size blades? I was doing that in 1983.
I was doing that shortly after I invented steel.
Right.
Kidding me?
Oh my
Jeez,
God.
fuck. I remember my first blade that I cut. It was by accident. I dropped my long sword after fighting in the Crusades, and I was like, I can use this.
Yeah. Bobby Limmer told me, what's with the microscopes?
What's with the microscopes? I'm over here using a chisel and a hammer, and you're using microscopes. That's brilliant.
Yeah.
Thanks, JC.
Oh man! All right, guys, listen, we're gonna go. Thank you so much for the calls and the good time. Listen, Hampton called in. We had to have a little fun. What's with the microscope? Oh yeah,
good times.
Extracellular matrix. I was working on that in my garage in medical school.
I discovered that when I burned a pig in my barn by mistake. Sorry, it's porcine bladder, and anyway, that was a stretch.
Shit. Anyway, you got to have fun, man. That's what life's all about. And that's, I have to say the most enjoyable part of my work is this show. And I don't not enjoy my work. I do enjoy my work. Listen, you're fielding insanity and bullshit all the time. But for the most part, my work week it's productive. I like speaking to.
You didn't know what enjoyment was till I invented comedy.
That's right. That's right. You never laughed before I cracked that first joke.
You didn't know what a laugh was.
Jesus.
Oh
Christ! I mean, maybe one day I'll make a list and read some really just interesting, hilarious fucking lines.
Oh,
just hilarious line.
All right.
I walk into a room, and someone else walks into the room. What do you think happens? Everyone gravitates towards me. Why? Because I'm smarter and more talented than anybody else in this field. That was actually something he said.
Yeah. Yeah. Good times.
I'm just like, all right. I actually thought they gravitated towards me. Just saying. All right, guys. Until next time. First of all, I want to thank everyone who supports the show. Thank you so much for the calls. We were busy all night.
Yes.
So thank you for taking the time to provide content for those who need to hear your stories. That's what this show is all about. The only reason we do it live. That's it. Much easier to do a podcast, record it, but your calls, your thoughts, your concerns, your fears, your experiences is really, to me, what adds all the value to this program. So until next time, be strong, God bless, and thank you so much for listening. Take care.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you.